My name is Mamta Vaish.
I'm Rita Seth.
मेरा नाम परमवीर सिंह वर्मा है.
My name is Kushal Sachan.
I am Vijay from Mumbai.
My name is Mridula Seth.
This is Sanjeev Pandey.
Hi, my name is Sindhuja Ramkumar.
My name is Shubha Chakravarti.
I work with an organization called Sambandh Health Foundation.
I have been working as a counselor for the last 22 years.
I am founder and director of RWH Holistic Wellness and Research Foundation.
By profession मैं एक pharmacist हूँ.
I have over 40 years of lived experience with bipolar disorder.
I am a caregiver for my sister.
मेरी बहन को स्किज़ोफ्रेनिया, एक्चुअली इसको स्किज़ोअफेक्टिव डिसऑर्डर है.
I am a carer साथी और a दोस्त of my nephew.
I have been her caregiver since the time of the first episode.
And his mother. So I'm दोनों की दोस्त.
One of my family members is suffering from schizophrenia for the last almost 30 years now.
जिस तरह आबादी बढ़ती जा रही है, जिस तरह रिक्वायरमेंट्स बढ़ती चली जा रही हैं, आप हैरान होंगी कि उसी तरीके से ही धीरे धीरे जो मेंटल प्रॉब्लम्स हैं, जो मेंटल स्ट्रेन है, वो भी बढ़ता चला जा रहा है. और फिल्में जो हैं वो हमेशा एक मीडिया का बिग ब्रदर मानी जाती हैं और फिल्मों का जो इम्पैक्ट होता है वो बहुत बड़ा होता है. आप किसी से कुछ कह दीजिए, शायद बात कम समझ आएगी, लेकिन अगर उसी को एक फिल्म दिखा देंगे तो उसको वही बात बहुत आसानी से और जल्दी समझ आ जाएगी, ऐसा मेरा मानना है. तो फिल्मों के माध्यम से हम लोग आम जनता तक पहुंचना चाहते हैं और लोगों को बताना चाहते हैं कि जिन्हें आप हिष्ट और पृष्ठ समझ बैठे हैं वो कहीं ना कहीं सोसाइटी में कहीं ना कहीं बीमार है और उसको आपकी मदद की और दवाई की या डॉक्टरों की ज़रूरत है. ये जो हम लोग जतन कर रहे हैं आम आदमी तक पहुंचाने का, फिल्में उसका सबसे बड़ा अच्छा साधन है.
So one of the really important topics that is discussed worldwide by people living with mental illness and their families is what after me.
To begin with, how did caregiving help me? I can't emphasize the role of a caregiver enough in a person's recovery from mental health, especially in a serious mental disorder such as bipolar disorder. Because it's a chronic condition, support is needed for possibly a lifetime, and the going seems very lonely and dark at times when the person is struggling.
प्रोफेशन के दौरान मैंने देखा है कि मेंटल इलनेस की जो केसेस हैं ये लगातार बढ़ने पे हैं.
Since COVID issue has already came, so now we have all become a sort of mental patients in our life, which cannot go away. Not easily. Okay, so each and every individual in every family is somewhat any kind of mental patient, be it either stress, tension, depression or any kind of stuff.
Mental illness impacts every aspect of a person's life.
We sort of often confuse between what are the symptoms of mental illness.
Patients जो है वो बहुत सारे, आप कहीं तो 3 में से 2 पेशेंट या 1 पेशेंट जो है मेरे पास ऐसा आता है जो मेंटल इलनेस से रिलेटेड बीमारियों का शिकार होता है.
Very impulsive in terms of nature, not very social in terms of interaction, but otherwise she has been stable. The government job helped her because of government job there was a safety net, and even though she may not have had good interpersonal relationship, it did not impact her job.
If we can give her education, which she was lagging behind earlier because of her disease, she was looking for job for a long time, लेकिन बहुत ही ज़्यादा दिक्कत आ गई थी क्योंकि हम उसको ठीक से गाइड नहीं कर पाए थे.
He has lows and ups. His moods keep changing. Sometimes he's very excited. Sometimes he's very, very depressed. And it is such times that it is the mother who really boosts the morale of the person. And I, as a carer sathi or a friend, try to help both of them.
She's my sister first, and she's not any patient for me.
There is a little bit of a confusion in people what qualifies as mental illness. So mental illness can also be called mental health disorders, and they refer to a wide range of disorders which affect our mood, our thinking, our behavior, and they can be depression, it can be anxiety disorders, schizophrenia, any kind of addictive behavior or eating disorders. All these qualify as mental disorders.
I have a few questions for people who have been diagnosed recently with mental illness, or in the recent few years, let's say, with mental illness. Do you have a very limited perception about yourself? Do you identify yourself only with the illness? Or are you able to see yourself as separate from the illness? Do you see the illness as life-defining? Or do you see it like a blood pressure or a diabetes in your life? Do you see yourself as a whole human being? Do you see yourself as a person with potential? Do you see yourself in terms of your strengths and aspirations and capability? Or do you see yourself as, say, incapable and limited and in some cases even doomed? So what is the way that you see yourself? Because this perception will actually define your life, not the mental illness. That is my experience of having worked with mental illness for so many years.
Over the years, it has been so much of receiving from so many people beyond, and I would say it would be beyond family. There were my peers, there were my friends, my colleagues who have wholeheartedly supported me.
उसका मेडिसिन चल रहा है मेरी सिस्टर का, और मैं बहुत ही खुश हूँ कि उसको भी अच्छा लगता है कि मुझे कुछ करना है. I wish that whatever she wants, she gets that.
The role of a person whose loved one is going through a mental illness is very critical, because on one hand you cannot force people to seek professional help, but on the other hand it is required.
So for instance, if I have bipolar disorder and if my family does not realize what I am living with, thinks that I am just whatever my symptoms are, my serious struggles are of depression or mania, it is just a behavior issue or about a personality issue. So you can imagine, then that atmosphere becomes even more toxic for the person.
So a caregiver's role comes in as encouragement and support to your loved one, and you can take an appointment for them with a doctor, with a psychiatrist. You can accompany them for the appointment. Of course, if it is suicidal thoughts which are being experienced, then you cannot leave it to just being a supportive kind of a role. Then it has to be treated like an emergency.
But the challenge is, because of the utter lack of awareness, many parents are in denial. Many parents or siblings or whoever the relative caregiver is from family,
she still has not accepted her bipolarity and refuses to go and see a psychiatrist. And so we have to basically go and talk to the psychiatrist and fine-tune the medication. So it is a force feeding that we need to do.
Feel haunted by the thought of what will happen after I'm gone. But this preparation has to be made during the lifetime. I've seen that with my sister-in-law, that we keep talking about what is going to happen, and we have to provide opportunities to the person to take part in opportunities where they can learn through experience to make decisions, to build their life skills.
So what is it that a person living with mental illness needs from their family, needs from society?
People feeling self-stigma. So जो बीमार है, who has been diagnosed with a mental illness, starts blaming themselves for their illness, and they start seeing, because we victimize them, the society victimizes them and says, तुम ऐसा सोचते हो, तुम ऐसा करते हो, as if it's not a bimari, as if they have caused it themselves.
When you look at recovery, there are two most important things. One is medical recovery, where medicines, the psychiatrist, the medical reviews, maybe the involvement of a clinical psychologist is very important. And that happens, quarterly in a year or so.
Caregiver, agar apni counseling ke liye jayega, they will realize that it is their fears which are preventing them from being an effective caregiver and not giving the support and help which their loved one needs with this illness.
In between those reviews, there is a whole life to live. And how does one live that life? How does one fulfill the relationships in life? How does one ensure that they are able to pay for their living? How does one ensure mental stability and wellness by engaging in, resources that help wellness? How does one fulfill one's own desires and aspirations? All these are really important things in life.
One needs to trust the journey.
We as a society need to be more proactive in our approach. So, proactive as in if we see something in a person which is a matter of concern, a sign, a symptom, or suicidal thought, we have to help, rather than a reactive approach where we just choose to condemn a person for feeling this way.
So whether it is the person with the mental illness himself or herself, or it is for the family carers, at the end of the day, you can do your XYZ amount of caring, and at the end of, beyond that, you have to just trust the person's path.
Rather than people thinking, especially family members, thinking that they are the only ones who can take care. Nobody else can do a better job. If we actually share this responsibility with community, with the different community resources, not only will we feel less burdened, we will actually be enlarging the support system for the person. We'll be helping enlarge the support system for the person who has a whole life to live beyond us.
From my perspective, as a person with mental illness, I would say if I were in the shoes of a person looking for support or in a deep state of struggle, first thing that I would demand or would wish that I would get was respect.
Hopefully, I will be able to put some light in her life, and she is putting a lot of light in my life.
So I would like to briefly also talk about some of the causes of mental illness. So it is genetic, it is hereditary, and the hereditary causes, like in any other physical illness, can get triggered by environmental stressors.
As I have shared earlier in brief, I have been only been showered with love and respect in most of my interactions. But not everybody is so fortunate. Yeah, let's be realistic.
ये बीमारी बढ़ बढ़ के जो है उनको बहुत आगे ऐसे पोजीशन पे ले जाती है कि वो वापस सोसाइटी में मूव करने के लायक नहीं रह पाते हैं.
What they require is emotional support. What they require is an understanding of life. What they require is an understanding of mental illness. And those connections in the community are as valuable to them as they are to us.
Are the family members, encouraging in that in their roles? Yeah. Are they saying that let's give it a try? Yeah. We don't mind if you fail. Or are they beginning with this is way beyond what your capability is? That can crush the person.
So, if families work towards connecting their loved ones to all the community and knowledge resources, it may be a little uncomfortable initially, it may be a little difficult, but it is an effort that is worth it.
There is a need in our society that we need to empower those patients to take care of themselves, to handle their situations very well. It can only happen by actually training them to how to survive loneliness.
So हम लोग कोशिश कर रहे हैं कि जितना भी उसको सपोर्ट हो सके फाइनेंशियली, फिजिकली, जैसे भी है. एंड टाइम टू टाइम जस्ट मोटिवेट, जस्ट एनकरेज. ये 3-4 वर्ड्स ही है जो हम उनको बोल सकते हैं, नहीं तुम भी कर सकते हो, तुम भी आगे बढ़ सकते हो. तो आई थिंक दैट दीज आर गोल्डन वर्ड्स कि हमारे बाद हमें इतना चिंता नहीं रहे कि वो क्या करेंगे.
So it is very important for the caregivers to make sure that the person with mental illness is as independent as possible, so that there are certain provisions that are there in our laws which enable the person with mental illness to live an independent life even after the caregivers are no more or are incapable of taking care of them.
I will love her till my last breath, and I just hope that she does very, very well in her life. And I'm sorry, for everyone, I think that they should do the early intervention.
Like they are actually patients, so it is very important for our society to change our perception towards those individuals.
I feel that people who are still very young and have just, begun to see the impact of mental illness in their lives and their families, it is in their hands to a big extent to change the course of their lives.
I don't think persons with mental illness and caregivers are too far apart. Yeah, we know, in fact, that persons who are in the role of caregiving for a very long time, they themselves also go through a lot of stress, anxiety, worry, and that takes a toll on their health also.
It is the same for anybody who's suffering from mental illness also. It is a long-term issue which they are anyway going through. The person with mental illness is going through, and it is a very demanding illness. That is, it is not only demanding from the person who's suffering, but also from the family.
My message to people living with mental illness would be to see themselves in terms of their potential, to see themselves as whole people, as capable people, and work with their strengths, with whatever support they need.
Anybody watching this would be that, as a society, as people, we are told, don't look at something because looking at it gives it power, right? So if it is mental illness, if it's emotions which we consider negative, which means if it's anger, it's sadness, don't look at it. आप उसको बहुत power दे देंगे. As a person working with people in the field of counseling, I would say, look at every feeling. Looking at it in the eye, naming it gives us power to heal. And
let us become a dost, a friend of any one family who needs not just financial help but emotional support. And we need to do it as a family, as an extended family, where all of us can become supportive to each other.
My message to the families would be to support your loved ones in becoming as self-reliant as possible while you are around. Help them to connect with many other sources so that when you are gone, they don't feel alone.
This acceptance and not stigmatizing from our side as family members of people with mental illness. If we accept, they talk about different stages of how we go through any situation. So we first deny and then we say, oh, why us? Why has it come to us? And then we go to acceptance as the final stage. I think that is something that we need to achieve sooner, the better for us and for the person who's suffering from mental illness.
We have to accept it. Yes, there are problems in our lives. Okay, acceptance is the first part of the solution. You acknowledge that there is a problem, then and only then you will figure out what would be the solution. Okay.
But we have a responsibility of ensuring that we keep them in a stable condition, irrespective of their acceptance or non-acceptance of the situation. And so my message to all of you is, let's combine, join hands and work out a solution for the mentally challenged kith and kin, so that they are taken care of even when we are not around.
Just connect with some good peoples and we can actually move forward in life. We will help you move on and move forward in life with positive attitude and motivation and empowerment.
If we are able to see that mental illness is due to a chemical change in the brain like any other illness, we also see that there is no real basis for stigma, and we can all participate at our level to help the society overcome this stigma. That is my message to the common man who's listening to this talk. Thank you very much.
What I would like to end with is have faith in the person.
You see, documentaries are very common these days. It's on mental health, and especially after the pandemic, you have so many of them, and it's all meant for sharing with the public that mental illness is an illness and people come out and seek treatment, so on and so forth.
हाँ, शिवानी तपलियाल जी जो ये डॉक्यूमेंट्री बना रही हैं, ये इस दिशा में बहुत अच्छा प्रयास है इनका, और ये ज़्यादा से ज़्यादा लोग अगर इसको देखें और आगे इसको प्रमोट करें तो मुझे लगता है कि उन लोगों के लिए और सब समाज को भी के लिए भी ये अच्छा एक कदम इनकी तरफ से है.
We don't really use the word caregivers and PMIs and maybe users and caregivers or patients and care providers, things like that. A family is a family. We live as a family, we die as a family.
मैं चाहता हूं कि आप सब हमारा इन फिल्मों को आगे पहुंचाने में सहयोग दें, क्योंकि ये छोटी छोटी परेशानियां जो दिमागी परेशानियां होती हैं वो कब अचानक बीमारी का रूप धारण कर लेती हैं इसका हमें खुद भी पता नहीं चलता. तो इससे बेहतर है कि इन तमाम छोटी छोटी मुसीबतों को पहले ही आपको पहली स्टेज में पकड़ लेना अत्यंत आवश्यक है, ताकि इसका असर ज़्यादा ना हो, ये आपको नुकसान ना पहुंचाए, आपकी आम जिंदगी के अंदर अड़चन ना पैदा करे, ऐसा हमारा मानना है. तो आप कृपा करके हमारी मदद करें, इन फिल्मों को आगे तक पहुंचाने की कोशिश करें, इन्हें खुद भी इन फिल्मों को देखकर इनमें से वो तथ्य निकालने की कोशिश करें जिन बातों को हम आप तक पहुंचाने की कोशिश कर रहे हैं.